your timer, and here is your question. Please read through it, and once you are ready, we'll begin.
Okay. Okay, I'm ready.
All right. So if you have read and understood, considering it communication skills station, please begin.
Hello.
Hello.
It's Bashir, one of the surgical show, working with Dr. Man. I'm calling call consultant. Can I check who I'm calling with? I'm talking with?
Yes. Yeah, I'm Mr. X.
Okay.
Yeah. What's your concern?
I'm calling
What's the call for?
I'm calling about to take an advice of post-operative patient, Oliguria, and on acute kidney injury. So it's time. It's okay with you to discuss the patient?
Yeah, go on.
Okay. 69 years old lady. Background of the cecal tumor with suspected liver mets, underwent right hemicolectomy. Was taken biopsy. She developed low urine output, 110 to 20 ml per hour for 8 hours later. So we checked the urinary catheter. There is no blockage also. So patient on assessment, patient tachypneic and tachycardic and low grade temperature. So she received 2 units of blood in the intraoperatively, and also the abdomen is flat and not tender and soft, and there is hemoglobin shown dropping and urea electrolyte slightly elevated, and also X-ray normal, ECG is normal with dropping hemoglobin. She only received the 1,100 ml in post-operative day 1. Yeah.
Okay. So what do you think the cause is? I mean, what's causing this?
I think the cause is the patient is dehydrated because there is the only 1,100 ml in post-operative day 1, and also checking the note, there is some blood loss. We received the 2 units of blood.
Okay. Do you think the patient is bleeding?
They might bleeding, but the abdomen is now is soft, not tender, and I will go for doing fluid challenge and serial abdominal examination. I will check for hemoglobin also.
You do fluid challenge, you mean?
Yeah, I will go to do a fluid channel challenge
Why do you do that?
because the patient is dehydrated right now. I will go for assessment patient from A to B. I'm focused to insert it two lipo cannula, taking blood for investigation cross-matching. Also, I will give the patient 20 ml per 20 ml per kg, like 250 to 5,000 to 500 ml in over 15 minutes. And I can repeat it until 4 times if there is no response.
How do you monitor the response? What do you
I
mean
will,
by if there is no response?
I will monitor the response by the vital signs, blood pressure, heart rate, and capillary refill also in the ward.
Okay, what else?
And urine output. If there is no response, I will go for central line insertion and HDU also to monitor the central venous pressure.
What do you consider no response in urine output?
Urine output, it's less than 0.5 ml per kg per hour.
Okay. So do you think this is a leak? Because you mentioned that the patient was went through right hemicolectomy.
Yes, it's one of the possibility and our differential, but the abdomen it's black and patient not toxic and there is no sign of peritonitis, but we still do have to consider it. And I will go for serial abdominal examination and check for also the inflammatory marker and arrange for ultrasound.
Okay, so do you want me to come to see the patient?
Uh, we not need you to drop now, but I'll go for fluid channel for now, and I will keep you updated about the case.
Okay. So do you think the patient requires operation now?
He may need operation, but
Re-exploration?
he may need operation, but now there is no clear indication for operation. I will keep monitoring a patient and do serial examination, and if we need we can tell you as soon as possible.
Okay. So do you want to transfer the patient?
Yeah,
Now?
now there is no need to transfer a patient. I will keep monitoring a patient on the ward through the vital sign and response to fluid channel. If there is no response after three pull-loss of fluid channel, I will transfer a patient to HDU and inform the HDU registrar for monitoring a patient, and also inform my consultant to insert the central line and monitoring the central venous pressure.
Okay.
Okay.
What are the causes of shock in this patient?
I think there is a hypovolemic shock, and possibly if there is any leak, could be septic shock also.
Okay. Okay, good. So update me about the flu challenge. and the patient status. And if it was necessary, I'll come back to see the patient.
Okay.
Good.
If you have any time, we appreciate it to come at any time to see the patient, and I will keep you updated about the status of the patient and condition.
Thank you.
Okay. Is there
Thank
anything else you want to tell me about the patient?
I will summarize the patient. It's 68 years old, female lady underwent
Yeah, you
You told. Thank
you
you.
summarized the case for me. Thank you. But I
Okay.
mean, is there anything else in the management plan you want to ask me about, or you want to tell me,
Okay.
or you worried about?
And the management plan, after I do full assessment of the patient and do the fluid channel, I will go for management the patient HDU and will prepare a blood cross-matching for if there is no response. I will check the hemoglobin. I will start the blood transfusion and the next day morning.
Okay, I think you told me that, and thank you.
Okay.
Update me about the patient later on. Okay.
Okay. Thank you.
Okay.
Mr.
Thank you. Thank you.
Thank you.
Bye bye.
Bye.